And there I was, all of a sudden, screams from every direction. It was quite intense and scary. And then I ran out of my office and went straight into the emergency room. Mr. Who's the boss? I promised you a story, right?
Yes.
Alright then. It was a calm evening shift and I was on duty. And there I was, all of a sudden, screams from every direction. It was quite intense and scary. It was scary because our hospital is located in a community where we usually have frequent clashes from community members and gang members. And then I ran out of my office and went straight into the emergency room. And we had so many persons there. I don't know what they were doing, but the atmosphere was so tense. And I looked at the side of the emergency room and I saw a young mother carrying a baby, and this baby was crying in so much pain. And the whole emergency room was filled with the smell of roasted meat. A few minutes before they arrived at the hospital, the baby was having fever and then started having unusual jerking and movement of the body. It was strange. But in this community, like I said, it's a rural community and they still have so many superstitious beliefs. And they believe that if a child or anyone at all is having this abnormal kind of movement, it's actually a demon that is either entering or leaving the body. So what do they do in situations like this? They use what they call refiner's fire.
This just sucks.
So this fire is meant to repel or expel the demon. So when this happened, this young mother was so confused, and with what she's been taught about this conversion, she quickly carried the child, shoved her feet into a hot burning stove.
What the?
This child was in so much pain. Tragic.
Damn.
So after everything, the child is calm, convulsion has ceased. Lo and behold, legs burnt like a BBQ. That was when she started to carry the child and straight down to the hospital. And family members who saw her too thought she actually intentionally burnt the baby's feet, and they were enraged with her and actually wanted to beat her up. That was where she actually told the full story. And they didn't blame her because it was a rampant superstition. This child spent 2 months in the hospital because of this burns. I've actually heard of mothers who burn their children when they are convulsing, but I hadn't seen it before. That was the first time I saw it. And it was so scary and confusing at the same time. This is a typical case of febrile convulsion, and it happens to some children when their temperature is higher than normal. Whenever you see your child convulsing, just be calm. If you don't know anything to do, just grab the baby and rush to the hospital. Just be calm.
Ah, right.
Oh, you think this is crazy? Subscribe and turn on the notification button. You hear lots more crazy stories. Just like every other mother, she was trying to help relieve the pain of her child. But one mistake that she did led to a very terrifying medical emergency. Now this is a true story, and I would like you to stick around to the end. You may learn 1 or 2 things from this story. And if you're new to this channel, please like this channel, share, subscribe, and turn on the notification button for more interesting stories. This is Grace. She's a single mother and a hospital janitor. She's known by all in the hospital for being kind. She always smiles whenever she walks. But behind those smiles, she fought a very strong battle only few knew about. Now this is Grace and her 10-year-old son, Dave. And Dave has been battling with sickle cell anemia for a very long time. And each of the crises felt like a death sentence. Of course, she's a mother. She feels most of the pains also, indirectly. And then one night, he started having a very serious crisis and he was in very serious pain. And then she thought to herself, I've seen doctors give injection to Dave through the thigh. I think I can do that. You see, Grace works in a hospital, and whenever Dave has this crisis, she rushes him into the hospital. And most of the time, the first thing they try to do is to secure a vein so that they can actually give medication through the vein. But almost always, the veins are collapsed. So what did they do first to relieve pain? They give Dave injections through the muscle, mostly on the thigh and the buttocks. Most times when they break the medication to give him, they get a few quantity of this medication and inject Dave, and Dave gets relieved, and they discard the remaining one. But over time, Grace has been collecting the leftovers of these medications, and she kept them at home. So that night, she thought, okay, I have syringes and I have these medications, so I can actually help Dave with his pain. And she was desperate. We drew a quantity of these leftover medications, and straight ahead, she injected Dave with his medication. But she skipped a very, very vital step, which is sterilization. You just can't miss that step. Anyway, she kept on doing it over a couple of days, and Dave was fine. And all of a sudden, the thighs became swollen and became red. And she thought, okay, maybe it's just one of those stuff, reactions on the skin and all that. But over time, the thigh became more swollen and red. And she started using hot water on this, but it didn't help. After a while, it started oozing out pus. She invited a friend who is a nurse to come and have a look at the wound, and she came, and it was so bad. So she advised her to take Dave to the hospital, but Grace refused to take Dave to the hospital. Maybe probably because she was scared or ashamed of what people are going to say. And she kept Dave at home, and she tried cleaning and dressing the wound by herself, and she gave Dave some antibiotics to help with the infection. But it didn't help, and it became so worse. So she decided to take Dave to the hospital. And when Dave was brought to the hospital, the whole hospital was smelling. During the examination of this wound, after cleaning the pus, you could actually see Dave's thigh bone. That means this infection has gone past the skin level, it has gone past the muscle level, and it's now affecting the bone of the thigh. This is what we call osteomyelitis. Dave was also having fever and vomiting and was restless. The doctors had to take action and give some medications, ran some tests, and helped Dave. Dave became well, but Dave was left with a mark that could stay with him for a lifetime. He was referred to a plastic surgeon where they tried their best to help with Dave's thigh, but it was so bad and it was beyond repair. Right now, Dave walks around with a walking stick. And this is because of a single mistake of sterilizing before injection. Now, this story is not to shame Grace, but is to point out the importance of sterilization and also the importance of knowing your limits. So let's honor Grace by sharing this awareness. And one of the ways you can do this is by liking this video, share, and if you've not subscribed, then go ahead and subscribe. Sometimes love needs wisdom to save. A few weeks ago, I traveled to a rural community for a locum job, and I was told an interesting story about a nurse that eats up babies after they're being born in the hospital. But before I continue this gist, please subscribe to this channel, turn on the notification button, and give us a thumbs up. So I left Lagos for this rural community. It was very, very difficult to locate, but I finally reached there in the night, and I met with the staff members of the hospital. They were very, very welcoming. But there was this particular nurse. She was everywhere, very, very active. She showed me around and carried my bag and showed me to my call room. She didn't even allow me to sit down. She started telling me stories upon stories. But there was this particular story that stood out. She told me about the former head nurse that eats babies born in the hospital. Not just any baby, but the first baby born in the hospital every month. How strange is that? Although she said she's been arrested. I wasn't paying so much attention to this nurse, but she mentioned something about how this former head nurse killed these babies. She said she usually boiled them in her coven in the spirit realm, and they die physically. The next morning, I was very, very curious about this story. This is because this lady had worked as the head nurse in this hospital. So I wanted to find out why and how she does this. So I had an interactive section with the medical director of the hospital. He told me that this lady had been married for 15 years now and she had not had any child. And so she became the laughing stock of the community. So she went on a baby killing spree. He also told me that she does this by injecting high doses of insulin into these children and just died without a trace of the cause of this death. But the good thing is that she's been arrested. And rumor has it that she disappeared from the cell she was detained and she appeared somewhere else carrying out the same killing spree on children. I just hope this is not true.
Now I'm scared.
So today I tried something crazy. I decided to be at the receiving end. I've always been at the giving end. So I decided that for every 20 subscribers that I get through each of these videos, I'm gonna inject myself with one crazy drug. And a few hours ago, about 1 hour 30 minutes ago, I injected myself with chloroquine, a very good dose of chloroquine. Now, chloroquine is an anti-malaria drug. It's been here for a while, and years back there was resistance to this chloroquine, but I find it handy these days because I've seen it work for multi-drug resistance malaria. After giving quinine and artesunate and the person doesn't get better, and chloroquine just works like magic for this person. So, and one of the commonest side effects of this chloroquine is urticaria. Urticaria is a form of hypersensitivity reaction, and that comes with intense itching and wheals on the skin. So I want to feel and understand what my patients feel when they take certain medications. So I'll be waiting for that reaction. And normally this chloroquine, you usually give it with an antihistamine or a steroid to cushion the effects of this reaction and all that. So, but I took it without these drugs. So let's just watch and see what will happen. And as you watch, I have a few minutes to go back to my duty, and I have patients waiting. So just a few minutes. Before that, I have a story I want to tell. This story, doctors in Nigeria actually work around the clock. Most of us put up with 24 hours. Some have seen 48 hours, just to pay the bills and all that. So we work around the clock. We work night and day. And then sometimes we just have a very thin window period to rest. And that could be around between 12 and let's say 4, because 4:30 we might have emergencies, or we might have to wake up to to do an early ward round so that we can go back to seeing our patients for the day. And then that fateful day, I had a very hectic day and had a couple of emergencies, and I think I had a labor case I had to monitor, and then finally she put to bed and I had to rest. And 1 a.m. I got a call from this guy. I know him, but we are not that close. A family member is not a very close friend. And then he called me that, "Doctor, please, I've been having headache since morning." And I was like, what the hell? I'm trying to sleep, to rest. And it's quite crazy for me. I didn't want to sound rude to him. I told him he should call me in the morning. So that's not really good for both the doctor and for the patient. So, but there is a solution for those living in Nigeria. There is Rigor Plus. It's a platform where you can consult your doctor, any doctor of your choice, anytime, depending on when the doctor sets his appointment time. You can consult him, tell him your problems, and then he, listens to you, prescribes drugs for you. And the good thing about this Rigor Plus is that they have pharmacy around. They can actually deliver your drugs to you, to your doorstep. If one can actually get groceries by just sitting at home and ordering, why not prescriptions too from the doctor? And then they also have labs around that you can send a dispatch rider to get your blood sample and take it to the lab and tell you your result, fix appointments with doctors and all that. doctors counseling and all that, many other things that they do on the platform. So I'm going to leave the link below on my description box. This is not a paid advert. It's not a paid advert. So I'm just telling you that this is beneficial to you. And so I think the chloroquine is trying to kick in. Yeah, I'm not yet seeing any wheel on my skin, but I'm just feeling this light stuff all over my body. I feel like pulling my clothes off now. I signed up for this, so anything. So for every 20 subscribers I get for this video, I'm gonna do one crazy stuff, inject myself with one crazy medication. But I have a nurse standby, to inject me with something in case it goes haywire. Wow, it's kinda shit. More. Nurse, just please subscribe to this YouTube channel. I gotta go. Ooh.